Good morning, everyone, and welcome. I am Guillermo Martinez, Deputy Director and Intergovernmental Liaison for the Institute on Immigrant Integration, Research, and Policy at the Rockefeller Institute of Government at the State University of New York. We are honored today to have our distinguished panelists and speakers joining us. We are also very excited to have over 140 webinar attendees joining us and representing institutions of higher learning, nonprofit sector, legislative branch of both our state and federal governments, and the advocacy community. This forum is being recorded and the video will be made available on our website and on YouTube, as all our other webinars are. We invite you to join us next week when the Institute will be hosting a discussion with a team of researchers from the Binghamton University who will discuss their recent work on English language learning practices and programs in New York State. Today's discussion on the credentialing and licensing of foreign trained immigrants and workforce development of immigrants comes at an opportune time. Major demographic changes are impacting every sector of our society, and efforts to quicken the federal government's process in issuing employment authorization documentations are in the news daily. This morning, we will highlight the need to improve workforce training and credentialing practices for foreign-born and share with you policies and programs working to that end. Now, I am honored to introduce to you Dr. Dina Refke, Executive Director of the Institute on Immigrant Integration, Research, and Policy, a thought leader, an agent for change, and an academic powerhouse. Dr. Refke.
Guillermo, thank you so much for that kind introduction. Welcome, everybody, to our webinar. We are talking today, as Guillermo has said, we are talking about brain waste. We are talking about how to avoid lost opportunities to harness the full strength of New York State workers and to invest in the integration of immigrants in the labor force. A 2017 report estimated that there are approximately 2 million foreign-educated immigrant professionals who are unable to work in jobs that utilize their skills and their trainings. And this phenomenon, called underskilling, is widely prevalent and constitutes a major opportunity loss, not just for the people who are engaged in jobs that do not match their skills and talents, but also for us, for all of us who care deeply about maintaining a strong economy and about global competitiveness. So the webinar today takes a deep dive into the ecosystem of workforce development for immigrants as we examine the issue of credentialing and licensing for foreign-born residents who hold foreign obtained degrees. We also investigate promising models that strive to address the problem of de-skilling and underemployment by not just targeting workers with workforce development programming that prepare them for the jobs that are in demand and contextualized English language learning program when needed, but also by working with employers to reduce bias against foreign obtained degree holders and expanding apprenticeship opportunities, work-based learning, and job placements. So before we dive in, since this is a webinar format, we just wanted to remind you and urge you to use the chat box to include your comments, your reflections, your questions for the speakers. And this is the only way we can interact with all of you. So we will be addressing as many of your questions and your comments as we can. So we know that our keynote speaker is experiencing some delays. So we will go ahead and jump into our first presentation, which will be by our immigrant integration fellow, Joaquin Sanchez Gomez, and Joaquin is going to discuss challenges facing many immigrant New Yorkers in accessing workforce development programs and securing quality, decent jobs that provide living wages that are commensurate with their skills and their talents. He explores the workforce development ecosystem in the US and emphasizes that work and learning for immigrant New Yorkers need to happen simultaneously and not sequentially, and that support systems are needed to ensure immigrant workforce integration. Take it away, Joaquin.
Thank you so much, Dr. Refke and Guillermo, and everyone to be in this seminar. It is my pleasure to share this webinar with these all these big stars, or it seems like it's a constellation for me. So I'm gonna share my screen. So there we go. So I'm gonna talk about workforce development policies for immigrants. So I would like to start this conversation by asking us three simple questions. Do immigrants have the same access to programs in each state? Is legal status important to accessing programs? Is it possible to design programs that can link immigrants into decent jobs? Sometimes we assume that the employment situation of immigrants is the same in all regions. However, the reality seems to be different. Accessing benefits is unequal depending on the state in which they are living, as well as the labor rights to which they have full access. When we say decent work or decent jobs, I'm talking based on the taxonomy that the International Labor Organization has set down of what is a decent job. To have fair income, to have the right to unionize, and to have like access to several rights like healthcare, social security, etc. So I will start with uh, a bit of a context. So these are the policies are focused mostly on newcomers. What we see on the data is that almost all organizations, like 90% of them, are focused on serving recent arrivals. This may reflect that as immigrants become more included into the US economy over time, there is less need for support. The field must carefully monitor the changing composition of immigrants over the time to ensure they are reaching high-need populations. In fact, in recent years, newcomers actually tended to be more highly educated than immigrants who arrived in early periods. And as you can see in the graph. We also see that 2/3 of organizations, and when we say organizations, we're talking about nonprofit organizations, stated that their service impacted economic immigrants, and 2/3 also focus on refugees and displaced people. These are this data is from the Project on Workforce by the University of Harvard. And this data in particular comes from the Maria Macesa Fund, which is an organization that funds nonprofit organizations. And what we see here is the organizations that receive these type of funds from the Maria Macesa Fund. For example, Washington State receive three organizations that are based in Washington State are receiving funding. 15 organizations that are based in California are receiving funding, etc. So the geographic distribution of organizations funded by the Maria Macesa Fund suggests there may be some regions where employment support for immigrants is underinvested or underemphasized relative to the need. It seems that some states that are underrepresented, however, according to statistical data, states like Nevada are important in terms of migrant populations, as well Texas, as the second state with more migrants. But what we see is that these states that are important in terms of immigrant populations, there are not too many organizations. I mean, Texas is really close to the Mexican border, and it has like an enormous Mexican and many communities living there, and it seems that it has only four organizations. So, why is it important to have workforce development policies for immigrants? According to the ILO, 5 out of 10 immigrants are economically active. Even those who migrate for reasons other than employment expect to find a job in the place where they will settle. It is fundamental to have an institutional framework that facilitates integration of immigrants into the society. For this purpose, it's important to articulate a set of policies that must have specific benefits for migrant workers, with the purpose of developing skills as to link them to decent jobs. As I mentioned, decent jobs is a concept developed by ILO. So the literature on workforce development underscores the need for specific skills development programs for migrant populations, since they face much more adverse conditions than their native-born counterparts. Lack of familiarity with the labor market and limited English proficiency rendered mainstream programs ineffective. In this sense, it is fundamental to have English language training as well as skills development that takes into consideration the needs of newcomers. In the case of workers' unions, it should be highlighted that many of the training they offer are given in a wide variety of languages. As an example, construction in New York has a high presence of people from Ecuador, Poland, Russia, and Armenia. And these organizations are given courses about safety at work, as well on how to handle hazardous materials in their languages. Another important element is the link that the training process must have with the labor market. Finally, the main goal of every workforce development program is to integrate people into the labor market in the best possible conditions. In some cases, it has been seen that nonprofit organizations manage to capture the needs of certain industries and carry out agreements in which migrants are linked to certain workplaces, as for instance, Building Skills Partnership is doing in Southern California with several agreements with companies to find jobs to train immigrants. There's an example, they work very closely to the Los Angeles International Airport and many of the airports in Southern California. So on this final graph, I synthesize how it will be possible to integrate a platform that allows workers to know and access to different programs that are offered by the multiple organizations identified. One of the problems that I identified in the interviews I had with experts is that there is not too much promotion about the trainings. For this reason, it should be more efficient if all the opportunities can be integrated in a single platform or application, so the immigrants can look into the entire offer and be part of one or more of their benefits. In this sense, the strategy becomes holistic in terms that they will be able to receive support and wrap around services that address the challenges they face, develop skills that are in demand by the labor market, and find a decent job that utilize their skills. Another area of strength is to start thinking on training to allocate migrants in economic activities that create much more value added, not only the stereotypical jobs. Thinking about migrants to spaces where they historically had barriers should also be the objective of a strategy that has equally as its central axis. So, well, thank you so much.
Joaquin, thank you so much for this presentation. Yes, we do fully agree with you. Our system is a little fragmented. A level of coordination is needed at the regional level, while there are a lot of good efforts is being done at the regional level. We still have a very, very decentralized system and some level of centralization that bring in a unified strategy would really work better to serve immigrant and more effectively integrate them into the labor market. Thank you again. We are delighted to welcome our keynote speaker, Jina. Jina Krause-Vilmar, who is the president and CEO at Upwardly Global. Jina will examine models of workforce inclusion for immigrants and underscore the need for a two-way approach of immigrant workforce integration, where immigrants receive workforce development training and work-based training and learning, and employers strive to remove systemic barriers to immigrants' participation. We always say that immigrant integration is a two-way street. And so she will discuss systemic change needed to bring about full integration and explore groundbreaking work at Upwardly Global, the impact of this alternative to bridging program, and the partnerships the organization creates with employers to which they advocate for change. And she will address how the program is used to fill labor shortage in the healthcare field. Jina, the floor is all yours.
Thank you, Dina. And she didn't say I'll be doing all of that in 10 to 15 minutes.
Yes, a challenge. Sure.
So I wanted to take a step back and sort of emphasize some of the urgency around this issue. We all know that we're facing labor shortages across industry. And that is not only unique to the United States, that is something that exists across many countries. So when we look at OECD countries like Germany, like Japan, like Brazil, most of those countries already have a labor deficit. They don't have enough labor to fill the jobs that they have currently. Now, that dynamic is global, not only because we have decreased fertility rates, but if you look at the United States, 86% of our working age population today comes from immigrants and the children of immigrants. In 2030, which is just around the corner, that will be 100%. So our ability to build models of immigrant workforce inclusion are critical, not only for those communities, but more importantly, for the United States to continue to grow, innovate, and create shared prosperity. I was looking at a statistic that was really interesting, which said that if we stopped immigration today, by 2100, we would halve the population in the United States. Now, when I say that, I think of Avengers Endgame, where half the people in this Zoom call would not be here, because that is how the demographics are looking for the country. So we need to figure this out. So that's the sense of urgency. I also want to say this is across occupation. We're already seeing in many states that they're trying to figure out how to get more licensed, credentialed talent into their states. And they're all sourcing from immigrant talent or from other parts of the country. For example, right now in Texas, the Department of Education is recruiting and sending teams to recruit for teachers from Puerto Rico. They don't have enough teachers. They're not going to be educating enough teachers to take in the jobs. So they're now looking to figure out how can they get that talent into the country without having to deal with the credentialing issue. And this is the thing, if we were able to fix the credentialing system so that we were able to recognize credentials, recognize value credentials, and plug those skills into our labor force, we would be so much better placed as a country to be competitive. So I'll also say Utah's trying to figure this out too. I'm actually in Utah right now. And in Utah, they are looking to recruit Ukrainians from Europe to come, who are seeking asylum, to come directly to the state of Utah and offer them a refugee-like package of 3 months of support that the state itself would fund in order to help fill workforce gaps, right? So various states are doing multiple things. One of the things that we wanted to talk about was credentialing, and specifically around doctors. So we have seen recently a huge uptick in passing legislation in states that allows internationally trained medical professionals to work in those states. Illinois was just the latest state. That legislation will be going into effect in 2025. And what it basically states is that IMGs, internationally trained medical professionals, will be able to work underneath a US licensed doctor for 2 years, earning a physician's salary, and then work 1 year in a rural area. And after that, they're a fully US licensed physician. So that not only helps us get doctors into the country, into the state, but it also helps us address some of the doctor labor shortages we have in rural areas. And it maintains the integrity of the credential, because in order to be licensed, you still have to take the US medical exams, step 1, step 2, and step 3. And so what we want to demonstrate is that there are creative ways we can thinking about eliminating barriers to relicensing and credentialing that would allow for people to re-enter their space in a much faster and cheaper way. Right now, without that legislation, it takes up to 5 to 6 years to relicense or retrain as a physician. And it is an investment of $10,000 in order to pay for all of those exams and get the clinical experience they need to compete for residency. And so that Illinois has passed that. Washington State already had similar legislation. Virginia has legislation that has passed the House and the Senate and is now in the governor's office for signature. There are 10 other states that are also looking to pass similar legislation, including historically red states like Texas. And so what we're seeing is this huge trend, and what I call it is the race for talent. So we know that licensing and credentialing has become a red tape barrier for many people to re-enter into their field, and states are recognizing we have 165,000 internationally trained doctors sitting on the sidelines right now. In the state of New York, we have 1.2 million international medical degreed individuals. That could be nurses, that could be a radiologist, that could be many different types of medical degrees that are sitting on the sidelines. And if we don't figure that out as a state, those individuals are going to be going to other states that are going to be taking advantage of that talent, while we still have talent shortages and future talent shortages in the state. I think one of the lessons we learned as Upwardly Global, helping pass that legislation in the state of Illinois, was that proximity and insight is incredibly important, which means bringing together a coalition of nonprofits or community-based organizations that have been working in that state. For example, we worked with a Pakistani Doctors Association in Chicago, right? Organizations who are from those communities, who are representing those communities, who deeply understand the barriers that are specific to those locations, that proximity, and providing those insights is critical to informing legislation that makes sense for that state and the realities that those physicians barriers they face in that state. I think the other thing that we learned is that, having the business case is important, but having champions is also critically important, and that we can't stop at the policy level. So what I mean is policies are just regulations written on paper. They're only so good as they're actually executed on, and that they actually really relate to outcomes. So in Illinois, we're in early days. Right now, we are working with the regulatory authorities on how those regulations will actually look in terms of implementing the new legislation. That's an important step and phase, especially when it comes to learning about what that looks like. And then the next one is how we actually then working with business and employers to ensure that they understand this new legislation, what it means for them, and that that they're hiring. And so that we're making those matches between the talent and the businesses. Because once we start getting outcomes, that then sort of generates greater and greater support for legislation like this, not only in that state, but potentially relating to nurses, potentially relating to other internationally credentialed teachers even, fields, and then it also builds momentum across the country. So I would say, for us, it's the policy is the first step. The second is getting the regulations right. And the third is actually getting people in jobs and employers filling roles so that we can demonstrate that this is actually a win. The other thing I wanted to talk about is, and so for that sense, I know I'm hoping there are a lot of people from the state of New York in office that are on the call, and to say to you all that what we need is vision. Jina talked about a decentralized system. Jina talked about the fact that there's some fragmentation, but actually what we really need is not only coordination, we need vision. What do we want our credentialing evaluation system to look like for our state? What is it meant to achieve? What is that overarching framework? And then how are we coordinating and making sure that we're actually building and executing on that? So for example, Many of this relates to internationally trained professionals, but also relates to people across states. Hospitals in New York City cannot hire somebody who is a physician, who is certified as a physician's assistant in New Jersey, because that person would have to re-certify in the state of New York, right? So somebody technically who's just coming an hour away could potentially not be supporting our hospital systems in the state of New York because of that. So we really have to have a very unified system that has a clear vision of what we're trying to achieve. And it's important in particular right now, because as we're thinking about, okay, we have lower fertility rates, we know immigrants and the children of immigrants are our current working age workforce, and they will be in the next 6 years, 100% of that workforce. So then that means, how are we ensuring that we're setting these individuals up, especially if we know there'll be a skills divide? So what we're going to end up having is because we will continue to have labor shortages, we're going to have fewer and fewer people who are qualified to fill those mid and the high skill roles, even though we have 2.2 million and underemployed internationally credentialed immigrants in the United States today. We will still continue to have that skills divide, and we'll have a lower surplus on the low skill. So to Joaquin's point, actually, we need to be thinking about when people are in jobs, even if they're entering low skill jobs, how are we investing in them to climb up the ladder and upskill along the way? And that means we're going to have to solve the English language challenge. Credentialing and English language are some of the two important things for us to be able to get the right people into the right jobs, which means skill-aligned jobs. And if we are investing in English language when people are working in their companies, and Tyson Foods does this, for example. So Tyson Food is a national organization. They're the meatpacking industry. I would say 98% of their workforce are immigrants. And what they do is they provide English language training on site during work hours for their employees so that they can invest in their English in the hopes that they then continue to climb up the economic career ladder within the company. And part of the incentive is they get, once they pass a next English language level, they get a salary increase. And so that's been incredibly successful for them, because they have a labor force, and now they need to invest in that labor force so that they continue to thrive as a company. And so these are some of the models that we're going to start to need to be thinking about from the state and the legislative perspective, but also from what companies are trying to innovate with their immigrant workforce. What we do at Upwardly Global, we help people navigate. So one of the biggest challenges people face is, what jobs do I qualify for? Am I competitive? Do I need a relicense, re-credential? Do I need to upskill? What are the job titles I'm applying for? It's that career navigation piece. And the credentialing system is one of the biggest barriers for us to unpack and understand, because it changes by occupation and it changes over time. So we've spent a lot of time and effort working with states to write licensing guides. Those licensing guides need to be rewritten almost every year in order to stay up to date with changes and regulation changes. That's a lot of time and effort. And so that's not something a nonprofit should be taking a lead on. That's not my recommendation. My recommendation is for the state to take a lead on that. And because it is so ever-changing, it's a muscle. It's a muscle that the state needs to build. It's not a one and done. But what ends up happening is that creates credible insights for people in terms of where they start and how they land. It's the GPS that they need in order to get to that skill-aligned job. And so we work with those individuals on the career navigation, but also on we have to have a real conversation in this country about culture. We use the word integration, we should be using the word inclusion, especially with the numbers I just mentioned. And when I'm talking about inclusion, I'm saying, how are we allowing people to show up in an interview where they're not dinged because they aren't perceived as a culture fit? Now, obviously, this is more critical for people who are working into professional roles because of how we understand what collaboration, teamwork, initiative should show up as. We have to have the cultural fluency to understand that can show up in different ways and that the skill is still there. And this is becoming even more urgent with the onset of AI, because what AI is doing is unleashing human potential in a way that we are becoming more focused on what those quote unquote soft skills are and how they show up. And so for that, we need to have a conversation about what does cultural fluency look like. And that's actually something we work with our employer partners on. We have 150 employers. Most of them are Fortune 500 companies like an Accenture, Oliver Wyman, Deloitte, Amazon, etc. And we work with both their recruiters and their hiring managers to understand, how do you understand the value of the degrees and the credentials of this talent so you don't throw it in the trash? Because either A, they have a degree from the University of Iraq and you have no idea what that means, or B, because they have 2 to 3 year gap on their CV because they were legitimately working a survival job or living in a refugee camp, right? And so how do we help people understand and unpack the value of those skills and do what we call skill-based hiring versus pedigree hiring? So that's something we work with employer partners on. We also create on-ramp systems. So we have internships for people wanting to enter into entry-level roles. We're looking at what does that mean for mid and high school roles, right? If we have internationally trained talent that are coming in and they want to get work experience in the US market in the mid and the high skill level and not at the entry level, how are we creating those on-ramp programs? We did this with New York Presbyterian Hospital, and we've taken 100 of our job seekers across industry, because hospital systems need jobs, whether it's in HR, in healthcare, in IT, finance, they need it all. So how do we take our talent and then present them for positions that are paid a professional salary for 6 months? I would say 6 months because it's really hard to ask somebody to get rid of a survival job without knowing if they're going to get a full-time job. So 6 months is a more stable request. And then the company uses that as an opportunity to understand the talent and then place them into full-time open roles. And what we found is that now that we've been working with New York Presbyterian for a while, a lot of people are not going through the maternship program anymore, the returnship program. They're getting hired directly because now New York Presbyterian has understood how to value this talent pool, and they've eliminated a lot of the bias they have from this talent pool because they already have seen 100 of these individuals and they know what this talent looks like. And that is a learning curve for companies that has to happen. And that only comes with numbers. I call it the tipping point. Every company has a different tipping point. Sometimes it's the first 5 hires, sometimes the first 20. But there's always a tipping point for a company before they understand the value of this talent and they understand how to integrate them into their workforce. So that was a lot. We need to work with employers, yes. We need to create on-ramp systems, yes. Employers do have bias and they don't understand the value of this talent, yes. Credentialing is a huge barrier that could unlock so much potential. That has to be the responsibility of the state, and the state needs to lead with a cohesive vision. And in order to do that, they need to be thinking about it from different perspectives, not only for internationally trained talent, but also from talent that's coming across state lines. Many states are innovating on this space. This is a really great opportunity to be leading as the state of New York. I think this is going to be more and more critical because we will have to figure out how to integrate immigrants into our workforce. And then the last is we can't forget that this also means English language is a priority for us. And I will just leave by saying during COVID, we had the head of COVID response in the city. And her comment was, we have such large workforce shortages in our healthcare system, and we knew we had them, but now it's heightened and it's been exacerbated under a crisis, that this is a national security issue. Workforce shortages in the hospital system is a national security issue. So if that's the case, how are we solving for it? Thank you.
Jina, thank you so much. This has been incredible. I wonder if you can take one question or two, since we have a couple of minutes here. So one question is about the ways in which the state is engaging undocumented immigrant workforce, especially those who graduated from our public universities or have experience from their home country.
So I think for undocumented, I don't think there's a lot of creativity around that. Obviously, there are services, so like childcare services for undocumented in order to facilitate integration into the workforce. That said, if you're talking about the formal economy, there isn't a lot of innovation. And I do think there's an opportunity there. I do think if people are able to identify jobs, that there should be an opportunity to request workforce, just like we do for H-1B visa holders, but for those that are in the country. So I think there's a space for creativity that we're not seeing right now.
Thank you. And another question is about clarifying the statistics you mentioned about the 100% of future workforce and immigrants.
Yes. So right now, 83% of those that are working the growth in our working age population is coming from immigrants and the children of immigrants. That means if you have two parents and you only have one kid, right? Or you have 0 kids, that population is not being replaced. The US-born population is not replacing themselves with enough children, right? So if that's the case, that means that all of that growth is coming from immigrants and the children of immigrants themselves. And we're finding either net 0 growth amongst US-born by 2030. So they're still having kids, but they're just sustaining their existing. There's no growth there.
Mm-hmm. Thank you, Jina. Thank you again for a wonderful presentation. It's time to move on, and then we'll engage Jina again in the Q&A segment, so please keep those questions coming. It's time to move on to Ken Silverman, Immigrant Integration Fellow at the Institute on Immigrant Integration Research and Policy. And Ken will discuss migrant, again, we'll delve deeper into what Jina has been discussing. The phenomenon of de-skilling, credentialing and licensing barriers, and the challenging facing foreign educated New Yorkers in obtaining those re-credentialing and reskilling to effectively participate in the US labor market using the skills and the knowledge they acquired abroad. And he will examine policy approaches, keeping in mind that policy, as Jina reminds us, is the first step. But he'll examine policy approaches to reskilling and the pros and cons of each of the policy recommendations he provides. Ken.
Great. Thank you so much. Hopefully everyone can see my screen okay. Great. So my name is Ken Silverman. I'm a PhD candidate at the CUNY Graduate Center and an Immigrant Integration Fellow at the Rockefeller Institute of Government. Thank you so much to everybody. Thank you to fellow panelists. It's great to be a part of this conversation. So I'm going to present a summary of some of the research I did last year for Rockefeller. And it's based on interviews with experts and stakeholders in the US, Canada, Australia, and the Netherlands. So in the literature, this phenomenon is often referred to as migrant de-skilling. It's essentially about a mismatch between country of origin education and host country employment, and often is due to the non-recognition of foreign credentials. The trope is now so common that it's depicted even in movies, as we see here, right, of this doctor who's forced to take on a survival job as a taxi driver. This is a relevant but highly critically unacclaimed Canadian Indian movie called Dr. Cabby. But this is a, excuse me, as Jina mentioned, this is a global phenomenon. And across the OECD, you can see unemployment rates of college-educated foreign-born exceed that of the native-born in almost every OECD country, including the US, where the share of immigrants arriving in the US who have college degrees has been increasing since the 1990s and is now almost half. Excuse me. So just some of the impacts. There's 3 that I want to go over. First is the double net loss of human capital, right, for both the migrant as well as for the host society. And as Jina mentioned, right, this is not just an economic issue. It also, as we saw during the pandemic, it's a public health issue, even a national security issue. But if you look at the economic numbers, right, there's clearly de-skilling has a significant impact. There's one study that showed that the loss in aggregate annual earnings for the US was $39.4 billion, in lost migrant skills. For New York State, it was $5 billion alone during that period, 2009 to 2013. This included as well 594 million in lost tax revenues for New York State. So the economic argument cannot be overstated. And employment, it affects other domains of integration, housing, stability, social links, and other areas. So there's sort of three main barriers to how deskilling occurs. The main one is sort of information asymmetry, right? The uncertainty for the individual migrants, as well as the uncertainty for employers, particularly around language and work experience on how those skills attained in the country of origin are going to transfer, right? And oftentimes we see that this leads to discrimination, bias, and normative perceptions based on this uncertainty, right? Because if you're not certain how to evaluate or recognize a foreign obtained degree, oftentimes employers become over-reliant upon proxy characteristics, things like ethnicity, race, gender, language, even accents to gauge employability. Sorry. And as we see, foreign educated immigrants are more likely than immigrants educated in the US to be un- or underemployed. And a third one is what's known as professional protectionism. This is sort of the impenetrability of host society professional associations or networks for college educated migrants to enter. So part of my research was to sort of outline the different policy models that are out there. Again, this is sort of taking a global scope and speaking very broadly. But the first are sort of generally what's known as bridging programs. And there's kind of two key elements that Jina was also discussing that I'd like to highlight, right? Which are these programs that work directly with employers. Upwardly Global is a great example of that. We see this also, proliferating in Canada. And then also what we're now seeing in other across the US and at the state level are these barrier reduction reforms, right? And there is a bill that has been in the talks in New York State. It is unfortunately stuck in committee in both the state Senate and Assembly. But there is a bill that would remove citizenship requirements for many professional and occupational licenses. For New York State in particular, immigrants are overrepresented in the workforce, right? They're 27% of the workforce, despite being 22% of the total population. And given many of these shortages in not only healthcare and education, other industries, but also there's a growing demand for workers with bilingual skills, which many immigrants could help to fill. Not to mention the fact that, as we know, since the pandemic, New York State has been experiencing population loss. So passing this bill would help in a number of ways. Second one is what's known as pre-migration programs. These generally involve training and skills transferability before the arrival of the migrant to the receiving country or while the migrant is an international student. And the third main policy model are what's known as mutual recognition agreements, or MRAs. These are typically conducted between governments or regulatory bodies and apply to entire professional fields. So the goal is to eliminate this need to judge people on an individual basis. So I've also kind of outlined the pros and cons of each. So bridging programs, it does encompass a wide variety of programs, but the main advantage is you don't need to negotiate with other governments. You don't even need to wait for national governments to take action, right? These can be done unilaterally on a state or local level. The problem, of course, is funding, right? And sometimes the programs themselves studies have shown that they can reproduce prejudice in their own ways. So they're imperfect, but the most common form. Pre-migration programs are known to decrease welfare dependence and can improve job satisfaction. But these can also be exploitative, right? Especially when you have migrants entering, certain lower paid industries. MRAs would be great if all countries could negotiate them, but they're very cumbersome to do so, right? And oftentimes because they're focused on specific industries, they end up only benefiting a select group of elite professionals. So lastly, I just want to look at some of the ongoing challenges and offer some recommendations. So, some of these are long-term problems, like the overall perceptions of universities in the global South, things like refugee resettlement policies that incentivize survival employment, also latent biases in promotions, right? So even if you get your foot in the door to a company or an employer, getting promoted doesn't often happen on the same trajectory for immigrants, especially for Black and women immigrants. And as mentioned earlier, entry into many regulated fields still require licenses with various kinds of restrictions, including citizenship. So some recommendations, there is a first ever global convention on recognizing qualifications of higher education from UNESCO. Still, only 28 states have ratified this. The US is not one of them. So this would be one step towards trying to, create an international agreement on credentials and degrees. Another issue that comes up is, of course, involving employers and regulatory bodies in future policymaking, right? Because employers are going to be the ones who are going to, need to do the hiring, having them at the table from day one would be helpful. Another one is that states don't have to wait for federal governments to take action, or national governments, or in the case of the US, for Congress, right? States can work on their own agreements, either with, unilaterally or with other subnational governments. Universities can do the same. This trend is growing, but obviously should continue. And states can also, try to develop their own sort of one-stop shop, right, for helping newcomers figure out how they can navigate these oftentimes very confusing systems, right? And that would definitely be helpful if states took a lead on that. And lastly, as I mentioned, right, passing the Empire State Licensing Act for New York State specifically would go a long way towards addressing many of these issues. And I think I'm at my time. These are my sources. And thank you so much, everyone, for your attention.
Ken, thank you so much for this wonderful presentation. Again, really great ideas, great recommendations that you had, specifically the mutual recognition agreements. We're talking about negotiations between countries and doing international agreements between countries around credentialing. Let's also talk about credentialing and agreements, doing recognition agreements among states and among educational institutions, so that we remove some of the burden of requiring re-credentialing every time you move from one state to another that Jina had talked about. So thank you again, Ken. Now it's time, my pleasure, to introduce the roundtable discussion. And our speakers will include our keynote presenter, as well as Ken and Joaquin, our fellows on immigrant integration, and of course our distinguished panelists, Paul Feltman, who's the Deputy Executive Director for Global Talent Policy and Programs at World Education Services, Mirvet Bassam, who is the lead job coach at the International Institute of Buffalo, Bob Doyle, who is the Assistant Director of Grants and Special Programs at the International Institute of Buffalo, and Naomi Alboim, who is the Senior Policy Fellow at the Canada Excellence Research Centre and currently at Toronto Metropolitan University. So, welcome our panelists. Our first question will go to Paul Feltman. And Paul, please describe to us the Global Talent Bridge program that you oversee at WES, the World Education Services, and share with us the lessons that you've learned in implementing this program that pertain to building partnerships and advocating for systemic change in the space of immigrant workforce development.
Wow, that's a long question. Hey, thank you very much for inviting me. It's a delightful to be here. And I will say one thing. I'm going to look at this mostly from the perspective of the glass half full, even though the glass is not nearly full. But I think back to when we started working on these issues around 2011, 2012, and how far we have come in addressing what is a hugely fragmented and complicated set of challenges that range from individual barriers to systemic barriers to programmatic issues to funding to policy initiatives, licensing reform. It's a really broad basket of issues which have to be handled in many cases state by state, which means the inherent fragmentation really makes this a challenge. But one of the things that I think I'm really excited about is thinking about the New York State and the fact that New York State has an Office of New Americans, one of the first that was established. It's been around since 2012. It is an amazing organization that serves, and I think this is an important construct and concept for us working in this field, is we need hubs and connectors, and we need places where people have both a holistic perspective, but also can make targeted efforts in very narrow areas of focus. I think about the New York State ONA and Laura Gonzalez Murphy, its amazing director, as having really over the years expanded to a range of programmatic efforts. And particularly, I think about the Professional Pathways for High Skilled Immigrants program. It's a program that our colleagues, good friends at Upwardly Global are the sort of state lead on this and manage some of the local efforts, but also groups that you will hear from in a moment, the International Institute of Buffalo, very much involved in doing this sort of work. It's an emerging field to carve out, if you will, special attention and focus on individuals who come to this country with high levels of education and training. Most services vastly underfunded that have preceded programs like this one have basically barely scratched the surface and have really touched on only the most basic of services. And for immigrant professionals looking to re-enter their careers, those kinds of supports are simply not enough. They're not focused enough. They're not pitched at the right level. So it's great to see New York State really in the lead on some of these issues, helping to match the global talent, which is increasingly highly skilled, with community and workforce needs across the state. There are also some amazing programs that are affiliated with the Welcome Back initiative here in New York State, based at LaGuardia Community College and at Lemoyne College, that take on some of these challenges very concretely for individuals working in healthcare. WES is a credential evaluation service. You talk about credentials, it's something we know something about. The reason we got started in this work really was as we looked at our clients, immigrants and refugees in the community who were coming in with master's degrees and applying for entry-level jobs or licenses that, or certifications or educational programs that were nowhere near the level that they had already attained in their home country. We realized that, well, credential evaluation is super important. It's a critical tool. It's not nearly enough. We found the need and found the opportunity to work with partners like Upwardly Global, like the Welcome Back Initiative, higher education institutions, community colleges, and local community service providers to try to figure out how we could collectively work to help individuals address their individual barriers of English language proficiency, for example, but also addressing some of these systemic barriers that often require policy intervention. We started doing the Global Talent Bridge. WES is 50 years old this year. We started the Global Talent Bridge program about 11, 12 years ago. And I could say I could count on two hands the number of organizations that I initially reached out to who understood and thought about issues of internationally trained immigrants and refugees. We now have a program map that lists going on about 125 organizations around the country, but that's not anywhere nearly enough. So we've come a long way, but we have a long way to go. WES works on programs. We do a lot of capacity building and community of practice work. We work with local communities as well as states through our skilled immigrant education program. We have a global talent leadership program. We develop a lot of tools and resources, including career pathway guides. We have a program map that I mentioned. WES also works in the field of philanthropy. The West Mary Masefa Fund provides grants to organizations that focus on economic and social inclusion. And at the policy level, and I want to touch on this because I think one of the three areas of focus. Investing in accessible workforce development training and career-related English language learning is a key area that involves both federal funding that trickles to the states, as well as state-level work, state-funded work, such as the Professional Pathways Program. We also see the huge value of having an organization like an Office of New Americans, or sometimes called, they sometimes go by other names in other states. There were about 7 ONAs, as we call them, Offices of New Americans, in 2019. There are now 19 states that have seen the value and the wisdom of having this hub where immigrant integration issues and inclusion issues, particularly focusing in many of these states on economic inclusion, have come together. It's a major part of our policy work across the country to try to see the development of new ONAs, and those ONAs work together and share best practices through an ONA network that we help to facilitate. And then licensing laws. New York State, Jina touched on international medical graduates. There are increasing opportunities, increasing number of states that have addressed licensing reform at the legislative and the administrative level in healthcare. I think it's a critical area. We're delighted that New York State has bills under consideration as we speak to try to expand an existing, I believe it's called a limited license to practice that international medical graduates have. It's not nearly strong enough. It doesn't allow for a long enough term and does not lead to permanent licensing, but we're hoping to see reform in New York State that brings medical professionals and other healthcare professionals more into the mainstream to build on and contribute the skills that they already have to the community. I'll leave it there. I think I'm well at time.
All right. Well, thank you, Paul. I don't know if Jina is still with us. Since Jina is on a tight schedule and traveling, I'd like to ask Jina a question about a post that she shared recently, and also her comments about soft skills and the immigrant community. And so in one of your posts, Jina, you mentioned our immigrant community soft skills such as creativity, collaboration, and resilience often show up differently than what U.S. employers expect. How do we equalize the playing field so everyone can participate in a workforce where these skills will increasingly become more important? You were commenting on a New York Times article that says that we are moving away from the knowledge economy to the relationship economy, and where people's skills and social abilities will be more and more core to success. And so as we try to change, the biased, homogeneous U.S. cultural model that perhaps sometimes locks immigrants out and view them as not competent in this area. As we try to change that model, do you also advocate for propagating or trainings based on these soft skills that are becoming core to success?
Yeah, I think this is something we're going to have to solve for. And I don't see a real urgency or appetite for it right now on the employer side. I think it will come, though, in the next 5 to 10 years in particular. And for me, it's about when I think, so oftentimes one of the biggest challenge, we often say our community, they have the hard skills, the technical skills to do the job. They don't know how to get the job. But the reality is they also don't present in a way that makes it authentic and easy for people from a U.S. cultural background to understand the value that they bring. And what ends up happening is you have a very subjective test between a recruiter and a job seeker that is like, oh, I think they'll be a good fit. Crazy stuff. We had a colleague who was interviewing at Chanel, and he wore a business suit. And the recruiter said, I think he's a little too stuffy, and I don't think he's going to be real. And something small like that could lock somebody out of opportunity and getting the next interview is insane. Mm-hmm. But this is the reality. This is why we teach people, firm handshake, eye contact, because it signifies confidence. It doesn't signify that you're devious. But the reality is also we have a distinction between people who come from a very individualistic culture, which is the United States, versus community-based cultures. And we are teaching people who come from a very community-oriented culture to be able to communicate in a way that is individualistic so that they can represent themselves and market themselves, frankly. And somebody asked me this last night at dinner. They were like, so does that become ingrained once we teach our job seekers how to do that? And the reality is no. They're able to mimic it for the interview and they're able to mimic it for the salary negotiations, but they can't do that in every aspect of their lives when they're in the workplace, which means that they are not best set up to rise within the company because they're not self-promoting constantly, et cetera, et cetera. Now, there are some skills that our community has hands down. They're resilient, they're adaptable, they're creative. And so the question is are there ways for us to value that, to test and value that, so that we can then say, actually, this person has a badge based on a resiliency test, based on an adaptability test, based on a creativity test. And we should recognize and acknowledge that versus submitting people to a subjective test. Now, Deloitte has a framework called Human Enduring Capabilities, but does just that. And so I think that's the conversation where we need to ensure that immigrants are part of that conversation. That said, I want to make one caveat. It's not just about cultural fluency, it's about power and privilege. So I often say it's not just saying, oh, I used to work in Kenya and I understand like sort of the Kenyan work style, but it's the reality is these people have so less power and privilege in our communities and in our workforce that they are not able to rewrite the rules of the game, rewrite how things are interpreted, rewrite how creativity is viewed. And so that's where the playing field has to be leveled, so that the power dynamic doesn't interrupt the cultural fluency that we're trying to build and amongst employers in order to be able to value and embrace this talent. I don't know if that answers the question, but
it absolutely does. Incredibly profound. Thank you so much, Jina. All right, so the next question goes to Mirvet. Mirvet, tell us about the work of the International Institute of Buffalo in workforce development and what lessons have you learned from your work about combating the phenomenon of de-skilling? How does an effective coaching and mentoring program in this space should look like?
Thank you so much for letting me present and share my experience here with you. So the International Institute of Buffalo has been in workforce field for a long time. We have numerous years of experience and several close partnership with companies who are eager to take in new talent. However, helping highly skilled refugees and immigrants to resettle in their professional position is especially challenging. Working with the IAB, we're having like employment department here and pathways team with our job developer makes these concerns less challenging. We are separating the word about our pathways program and reach out to lots of employers to make them aware about our high skilled clients and give them the opportunity to start their career here. It's challenging, just like my colleagues were sharing, especially like nowadays, and helping them and improving them with all our services. It can make this challenges getting a little bit easier for them. And also with I totally agree with that, New York State standards is also like less strict there, which is make their career or their journey is getting harder a little bit. But through IIB's network, we are able to resettle new Americans into positions that are similar to their previous ones, helping and guiding skills newcomers to find their place in professional workforce is actually of our goals. We continue to work with our clients to not only help them find work, but to also meet their long-term career goals. We understand with some fields, it takes years to be able to go back to their professional career. And we are helping to guide them through all these process so we can set up their short-term goals and also their long-term goals. Also, the unique training that we offer through Upworthy Global that has been designed to help those skilled immigrants have been very effective. It makes those new Americans aware about the U.S. work environment. And through our offering coaching, and guiding. We also give personalized support. The Pathways team here at IBI also career clubs and workshops to further enhance their skills. Through those workshops, we work on resume, cover letters, conduct mock interviews, create Indeed and LinkedIn accounts, and do much more for them so we can make them aware and more familiar with the US style here to make them show their proficiency. We let the client open discussion between between them and also with job coaches to answer all those questions and make them, as I said, more familiar with the US work environment. I'm really happy to help our clients here, and I think our effort is really effective in helping a lot of those new American newcomers to understand the workforce here and make them aware about what is the challenges and what is the step that they need to take. Thank you.
Mirvet, thank you so much. Do you also work with the employers or the industry trying to advance these, what Jina calls the cultural fluency aspect?
Yes. Yes, exactly. We are educating both the clients and the employers and make them aware about. So we educate the clients about the work, U.S. work environment versus we are also educated the employers on how our clients are skilled and having all the experience that they're looking for. They just need the opportunity to enter that field and improve their skills.
And so are there, and this is connected to a question in the chat, are there evidence-based models that you use in diversity training? Dr. Lee is asking in the chat about that, that you feel works in really changing people's attitudes or changing the mindset around what is valued and what is not?
I mean, using the training through Upworthy Global and how it's show that's really effective though the small details, just like Jina was saying, like eye contact, handshaking, how to appear that you're professional is really, really important. And we always mention to that and keep those notes in our clients' mind so we can always, refer to that. Small details can really make like different between that you get accepted in these positions or this job or not. So we always refer to that.
Mm-hmm. Thank you so much, Mirvet. Next question is to Bob Doyle. The work of the International Institute of Buffalo seems to be a great model and a best practice for immigrant integration in the workplace. Can you tell us about your funding model? How do you maintain and sustain the programs at the Institute? We know for sure that, these programs need to be sustained through funding, and oftentimes really a capacity is limited based on funding. With funders, there's also increased pressure to demonstrate impact. Do you at the International Institute do evaluative studies to address the pressures to demonstrate outcomes of the programs and not just outputs? Can you tell us a little bit about your funding relationships and the evaluation that is required of the International Institutes of Buffalo and other similar programs?
Sure, yeah. So thanks again for highlighting the work that we're doing in Buffalo. The majority of our work on this program is grant funded. When we started this program, we actually got involved with this work kind of through WES. We joined one of their working group cohorts on how we can build kind of a model and a program for this in Western New York. A lot of our conversations with the community really focused on things like underskilled, need of people to kind of enter the workforce in a position commensurate with their skills after being resettled here. And that especially kind of picked up during Operation Allies Welcome when we brought a lot of Afghan arrivals to Western New York. So during that kind of whole process, we applied for some funding from the New York State Office of New Americans and were awarded the Professional Pathways Grant through them. And we're able to kind of launch a really small version of this program with just Mirvet. And then later applied for federal funding through the Office of Refugee Resettlement, and we're able to expand the program and now have 3 job coaches working at the Institute full-time with clients on upskilling. We also rely on donations both financially and donations of time. Our professional mentorship program is a really big part of that, and I think a lot of times it's kind of understated how important it is to bring in people from like outside so that our clients are not just meeting with our job coaches, but are also meeting with other professionals in their field and in the area. Buffalo's a smaller city. A lot of getting a job is just as much who you know as it is what you know sometimes. So really helping people to build professional networks while they're kind of building their knowledge base and going through the recredentialing process. And then I think as far as our outcomes go, we just really try to, from the beginning, set expectations, kind of both with our funders and our proposals of what we can do and what's realistic for them to expect. And then also with our clients on what's a realistic goal for them to set, what's a realistic amount of time for them to really accomplish these goals, and a realistic amount of work that they're going to have to do to be an active part of this process and make sure that they can reach those goals. We also offer wraparound services for people to kind of help fill in some of the gaps. You could have all the skills and all the credentials in the world, but if you have other barriers standing in the way of your entry to the workforce, that's going to become a bigger problem than even finding a job. So we have legal services. We can do financial assistance for people with things like going back to school, getting their degrees evaluated, getting additional credentials in Western New York. We also offer interpreting and translation for things like job interviews, appointments with employers to fill out onboarding paperwork, things like that, if people really need help with that, and even translating certificates and transcripts and things like that from foreign universities.
Thank you so much, Bob. This is wonderful. It definitely is. Looks like it's a gold standard when you really meet the individual at where they are, and not really without assumptions, without expectations or judgments, and really try to meet their needs in a holistic manner and advance the goal of success of that individual, and really address all of those social determinants of their success. Thank you for that. So next question goes to Naomi. Naomi, in your published work, you make the important argument with reference, obviously, to the Canadian system of immigrant integration in the healthcare workforce development system. You say that there is a need for a comprehensive human resource approaches to patient care and human resource management. While this was a reference to the Canadian system, in the US, we also have a very fragmented and complex system that is described as a patchwork quilt, developed with piecemeal approaches from industry to industry, from region to region, and is not equipped to address the dynamic and evolving and shifting needs of the workforce. Can you elaborate on this point that you make in your article, and how a healthy workforce development ecosystem of immigrants would look like, and what is an effective framework for coordinating across different systems to achieve collective impact?
Thanks, Dina, for that question that can't be answered in 5 minutes, but I will do my best to try. And thanks for the invitation. I've been working on this issue since 1986. So it's been a long time that Canadians have been trying to deal with this. First and foremost, I really want to address the assumption inherent in your question that there can be or should be a health human resource strategy specifically for immigrants. I disagree with that. Rather, I'm advocating for a health human resource strategy for all health workers that recognize internationally educated health professionals as an integral resource and component of our healthcare system, and that integrates IEHPs in the planning and development of that strategy. There cannot be, in my view, parallel human resource strategies that do not intersect. one for immigrants and another for, in our case, Canadians. One for those health professionals trained overseas and one for those trained domestically. One for each health occupation in isolation of other health occupations. In Canada, we have tried many different approaches over the years. In fact, I safely say that everything that has been discussed so far by all your speakers has been tried to a certain extent in Canada and more. And I'd be happy to discuss them during the question period if there's particular interest. All these efforts are important, but while immigrants account for 25% of Canada's healthcare workforce, only 58% of IEHPs get certified to practice their occupation in Canada. And the rest are either unemployed or underemployed or have left the healthcare sector.
Right.
Unless all these initiatives are connected to a broader health human resource strategy, they will always be a sidebar outside of the mainstream and accessed by some IEHPs in some occupations and in some geographic areas. As Jina said, we also in Canada are forecasting that 100% of our population growth and labor force growth will depend on immigrants. We need to really have a paradigm shift because the immigrants coming in are us. And they have to be integrated into our system because they are the new population, they are the new labor force, they are the new health professionals. Thankfully, we have created a system on the assumption that most healthcare professionals are domestic individuals who have domestic education and domestic training. That's changing, and we have to change as a result. Thankfully, this is beginning to change in Canada, primarily because of the demographics that I described and the impact of COVID and its aftermath on our healthcare system. Demographics are the single biggest driver for change. Our population is aging and they need more care. Baby boomers are aging and have enormous power and influence. They have higher expectations, want to age in place, and are demanding different kinds of services. Our health professionals are aging and retiring. Young entrants are not necessarily choosing to practice in occupations or locations where they're most needed. We are dependent on increased immigration for population and labor force growth. We are receiving 500,000 new permanent residents per year, plus twice as many temporary entrants annually, putting more pressure on our healthcare system, with many needing culturally and linguistically sensitive care. That also means that more IHPs are needed and being selected to come to Canada, but without a guarantee of registration to practice. COVID and its aftermath also became a driver for change. Our health system was strained beyond capacity. Many healthcare workers burnt out, retired early, or moved to other fields. There is a shortage of health professionals everywhere in the system and is particularly acute in certain regions and occupations. But necessity is the mother of invention. IEHPs were welcomed in public health units to vaccinate, to educate, to counsel immigrants regarding the safety of vaccines. And regulators introduced changes, albeit slowly and often in time-limited ways. Some introduced emergency registrations or temporary registrations, partial licensure, or supervised practice while IHPs worked towards full registration. All this proved that changes could be made, but there was still lots of variation between regions and occupations, and none were embedded in an overall interconnected health human resources strategy. Some work on this is now beginning in some provinces. So what are the elements of a comprehensive integrated human resource health strategy? It would, one, involve collaborative development and implementation including all major stakeholders, governments, educational institutions, regulators, employers, unions, agencies supporting IEHPs, and representatives of IEHPs. 2, recognize that IEHPs are an integral part of our healthcare system. 3, be informed by equity principles. 4, include a vision, and not just for certification, but a vision about what we want our healthcare system to look like and what human resources do we need to get there. 5, ensure that integrated planning for domestically and internationally trained professionals is done on the basis of disaggregated data on gender, race, and immigration status, as well as on the evaluations of program initiatives, in order to be able to understand the current and potential health workforce, forecast the future needs regarding numbers, occupations, and regions, forecast the education and training spots required in our undergraduate and graduate systems, both for domestic students and for IEHPs requiring some bridging. Identify immigration selection systems for our IEHPs that actually work. Identify registration processes and program supports that work equitably for domestic and internationally trained health professionals, and identify successful transition to employment practices that are fair, equitable, and commensurate with education and experience. The human resource health strategy would also, number 6, have an implementation plan with timeframes and identified leads. 7, build in ongoing data collection, monitoring, and evaluation. And 8, allow for adjustments and continuous improvements. I don't know if I've run out of time. If I have, I'll answer in the question period. If I don't, tell me, Jina, because I just have about another minute to go through some questions about the development of a health human resource strategy.
Please go ahead, Naomi.
Okay, great.
Yeah.
So here are some specific questions to consider when developing health human resource strategies in terms of education and training, immigration, registration, and employment. First, education and training. Can the education and training of domestic students and bridging for internationally educated health professionals be integrated as much as possible? For example, should bridge training programs for IEHPs be offered by domestic health sciences programs and include some integrated courses with domestic students? They all need the same course on ethics. They all need the same course in terms of clinical practice. There are some things that are common. Why not integrate them in the learning so they are integrated and can work together and respect each other and value each other's contributions? Second, immigration. How can we select those with the skills we need and ensure their qualifications are assessed and recognized either before arrival or as soon as possible after arrival? Mm-hmm. Should jurisdictions with responsibility for health, the regulation of health professions, and post-secondary education be given more responsibility for IEHP recruitment and selection? Given the need for health professionals in small centers and rural areas, should we prioritize people with experience in rural areas in their home countries for immigrant selection? How can we facilitate the transition from temporary to permanent status for those who initially entered the country as temporary entrants? Mm-hmm. Third, registration. How can we ensure that there are equitable requirements for internationally and domestically trained health professionals, and that they are transparent, objective, impartial, fair, and timely? Can we learn from the temporary COVID measures that were put into place and make them permanent For example, conditional, partial, and emergency licenses supervise practice, alternative assessment processes for education, language, recency of practice, including practice-ready assessments. Can we introduce new occupational registration categories that allow for laddering? For example, personal support workers to registered practical nurses to registered nurse to nurse practitioner, or clinical assistant to physician. And fourth and last, employment. How can we strengthen the links between employers and community organizations to assist employers to gain access to IHPs when filling healthcare positions? And how can we share best practices on equitable and inclusive recruitment and workplace practices? Lots to consider and lots of room for innovation. Thank you.
Thank you, Naomi. How powerful, incredibly powerful. I love the idea of changing the paradigm that immigrants are us. I just really love this paradigm shift. A lot of people in the field, however, say that there is a need for mainstreaming immigrant considerations into the system. And I think that's what you're talking about with equity and inclusion of equity and a lens and a fairness and inclusion. But until we have that system, a lot of people argue that a targeted approach is also needed. So you have a mainstreaming strategy that makes the system more sensitive to the needs of immigrant workers with respect to, again, the cultural and the linguistic issues that we talked about. And the familiarity issues, but also we need a targeted approach. While
I agree.
Get that ideal system.
I absolutely agree. Mainstreaming does not mean one size fits all.
Mm-hmm. Yeah.
Mainstreaming means using the resources that we have now, and there are lots of them, for domestic training and for domestic practice. Use those resources that are also available, should also be available to respond not just to the same needs that internationally trained people have, but to the targeted different needs that they have.
Absolutely.
But using the resources that we have, I mean, bridging programs, for example, if there is need, and there is a need for occupation-specific language training, why can't that be included in a mainstream program?
Right.
And only those that require the targeted occupational specific language training have that as one of their courses.
You're right.
It is quite feasible, I think, to use our existing infrastructure, our existing particularly in our universities and colleges. I would also think about, if you're talking about these folks working together at the end of the day, having them study together is really, really powerful.
Absolutely.
And having the internationally educated individuals to be able in a classroom to bring forward the cultural differences that should be taken into account, or the different approaches that have worked in their home country that might be absolutely transferable or adaptable here, would raise their value among the domestic students who will be their co-workers in the future.
Absolutely, no question about it. It's a wonderful vision of an ideal state of affairs that we should really strive for. We have enough time for one question, but I'd like to pause here and see if any of the distinguished panelists want to ask each other questions, or Guillermo, if you have any questions for the panel. if there are no questions, I'll throw the last question to all of you, and anybody can choose to answer. There is a phenomenon or a problem that exists in the field with a spatial mismatch. And this is a phenomenon that refers to the workforce development and employment ecosystems being positioned or located in areas that are not accessible through public transportation that many low-income communities need. And so what they call the suburbanization of employment means that there's less connectivity. How prevalent is this phenomenon in the work or the research that you do? And are there any solutions or strategies that you have thought about in serving the population or, studying the phenomenon?
I'll jump in. I don't think I don't want to limit myself to just availability by transportation. I think it's a much bigger issue. Yeah. If you only have certain bridging programs in certain major urban centers, it really is a disadvantage for people who don't live in those particular centers. I don't know about in the States. In Canada, we have a huge need in smaller communities and rural areas for health professionals, for example. And in some cases, we rely on the return of service, and I think one of your speakers spoke about this, I forget who, that in return for getting certification, they have to give a year of their life or 3 years of their life in rural areas. That's no way to retain people in those local communities. It has not been successful in Canada, although we continue to do it. It is not successful. How about making living in smaller communities and rural areas much more attractive? And the way you make it attractive is to go out and to recruit people who come from those areas in their home countries, who enjoy living in smaller communities, who enjoy living in rural areas, and who would be quite prepared to do that if their supports and services were available in those smaller communities. So if you have a mainstream system where, for example, every community college offers bridging programs in all communities, not just in major urban centers, you might be able to attract people to go and to stay. If you provide supports and services for their families in local areas, they will stay. So I think there are things that can be done.
Well, thank you, Naomi, and we'll leave it at that. We're out of time, unfortunately. We can have this discussion for another 2 hours. Thank you again to our distinguished panelists and speakers. We really, really appreciate the time and the wisdom, the insights that you shared. Again, to conclude, we are in a global war for talent, and we are at a critical point with the statistics that you all saw. We need vision. We need room for innovation. We need cultural fluency. Integration is a two-way street. We really need skill-based hiring and not pedigree hiring, to use Jina's words. And we need to view policies as the first step, not the last step. We need implementation plans, and we need evaluation, and we need data collection. We need also a holistic and a mainstreaming and a targeted approach. And in the words of Naomi Alboim, we need to really include all major stakeholders in the development of a coordinated strategy, but a strategy that also has an implementation plan, data collection and evaluation to make sense of the success of our efforts. So again, thank you all so much for joining us, and thank you so much for our speakers and the wisdom that you shared. Best of luck as you move forward. We have great admiration for all the work that you do. Please continue to do what you're doing, and best of luck. Take care. Bye.